Hi, welcome to HS 400 again. Today we're doing chapter 19, which is promoting healthy adulthood and aging. So let's get started with this. So first of all, we have to understand that as the world's getting older, we're getting older. With advances in medicine and healthcare and care quality of life, people are living to an older age, pretty much in first world, second world and third world countries. Now it's believed that people who can make it to 50 years old can survive to 70, 75th, 5 years old in third world countries, and if you make it to 50-year-old in first world, second world countries, you can live to about 80 years of age generally everywhere else. Okay. Now if you look at figure 19-1, it talks about life expectancies at birth, and as we can see from the chart, it's much higher in countries that are considered first world, but the conditional life expectancies for older adults across the board seem to be high no matter which country you come from, providing you make it to the initial age of 50. Okay. Now the number of people who are worldwide are 60 years old or older is expected to increase by about 900 million. Okay. Right now it increased to 1.4 billion by 2030. Right now it's about 900 million. Okay. These increases are expected to occur because we're providing better quality health, we're access to medications, we have access to better healthcare, quality of healthcare at home in home services. Okay. If you go to figure 19-2, we see the number of people worldwide who are age 60 and older will increase in the coming decades, and we can see that's across the board. Even in the age category of 80s, we see that number getting much higher as well. So again, stay healthy, eat properly, make sure you see a physician regularly and you can live to an older age. In third world countries this number is getting better because people are getting more educated, have access to pharmaceuticals they didn't have access before, and even though few and far between as physicians, they still have access to a physician who's able to see them and give them some advice on how to increase their quality of life. Now, the next slide talks about age transition. Now the categories that they're talking about here are aging transition and mortality transition. Mortality transition is a decrease in rates of death for age groups across your lifespan. So we look at those ages from childhood to adolescence, adolescence to young adulthood to middle adulthood to older adulthood, and then on. Then we can see that if you make it to 50 years of age, you'll be able to live to at least 70. No matter which country you come from. Okay. Now the aging transition is percentage of population represented by older and adults, and we see that's increasing over the last 10 to 25 years throughout the world because of population growth is increasing. Now the other thing that we're seeing through these trends is that the number of first world countries seem to have a higher infant mortality than third world countries. The reason for that is adolescent or prenatal care and baby care or infant care in the early years are influential in the survival of children. Okay. The next chart is figure 19-3, which is percentage of population that is age 60 years and older. And if we look at every country that's posted here, from the United States to Germany to Iran to Nigeria and Ethiopia, we see that there's going to be an increase. And those increases are much higher in the developed countries, but are still occurring throughout the world. Figure 19-4 is percentage of global population that's age 60 and older, and of course this chart shows it's increasing. Now if we look at 1950 to say 2030, which is our closest decade, we see that number's increasing dramatically, and that number's expected to increase to 2100. Okay. The next slide is healthy aging, and this relates to public health more so than anything else. The ultimate goal of public health is to make sure that as many people enjoy a long, healthy life as possible without illnesses or with reduced illnesses, with the capacity to move and enjoy the life that they have. And this increasing longevity is believed to be partially assisted because of the health that the people are going into with older health, the quality of health that they're getting, the type of nutrition they're having, access to exercise, access to information that's helping them propagate their life and live longer. Okay. The sad thing is, though, through public health records, is that we see that most people, when they live to these older ages, the last 10 years of their life is usually subject to some sort of disability, which impairs their life. And if we can avoid those disabilities or reduce those disabilities, the quality of life they have and the longevity of their life will increase as well. These disabilities, through public health, seem to be associated with poor nutrition, lack of adequate medication, lack of adequate care. People, when they get older, kind of think they're still fairly active and as young as able to do things they do when they were younger, and they're more susceptible to falling and getting hurt. Okay. Healthy aging continued. Many adults will require significant assistance with routine daily living. As we get older, we need people to help us. A large percentage of older people that are living alone don't have access to this care and are more subject to having falls or injuries and not being compliant with their medications, or have someone to take care of them properly, so their nutrition starts lacking because they can't go to stores. So we need to make sure that as we get older, we have a structure around us that provides for us the assistance that we need to succeed and live longer. Okay? Part of that is making sure that you have friendships and you call people and you have relationships with them to make sure that they're okay. If you know an older person, you should be reaching out to them and speaking to them regularly, just to make sure that you know that their needs are being met. Always inquire about when the next doctor's visit is, so that you know that they have to go, and if they can't provide a means to get there themselves, provide assistance or have someone provide assistance to get to those visits. The other thing you need to do is make sure they have proper nutrition, make sure they're eating properly, eating healthily, and of course getting rest. It doesn't take a minute to call someone and say, hey, how you doing? And it's a better person for you out of taking care of the people around you. Okay, so make that effort. Right, the next category is health promotion in early and middle adulthood. Okay, now adulthood is divided into 3 stages, as we mentioned before. We have early adulthood, middle adulthood, and late adulthood. Early adulthood is 20 to 40, middle age is middle adulthood is 40 to 65, 64, and then late adulthood is 65 and older, effectively retirement age on. Okay, the public health goals that we have for these ages is to make sure we reduce the mortality rate to as close to 0 within those categories as possible. So in early adulthood, we want to make sure we lose few as possible people through illnesses and sickness or any type of mental health issue that can end their life. The same goal is associated with middle adulthood, which is 40 to 64 years of age, to make sure that we keep them healthy and keep them going. And then for late adulthood, we know that these people are going to die, but we want to try and encourage them to live as long as possible, getting them to at least 75 to 80 years of age. And a big part of that is making sure we have access to the medications and physicians and the type of care that they need. In third world countries, this is kind of hard to do because of the lack of physicians to patient ratio. But we're trying to make it so that we're educating people in cultures and in communities that there is some sort of healthcare provider, be it a medical assistant or be it an LPN or an RN that's caring for people, to make sure that people are getting a standard of care that's increasing their quality of life. The other thing we're trying to do is reduce the amount of disability in the productive areas of life after the age of 65, to make sure these people still have adequate ability, adequate movement to help themselves survive. Part of what we can do here is to make sure that older people, by the time they get older, in some sort of exercise program or yoga program for flexion and mobility, so they can prevent themselves from falling by having a better stable core. Also, we need to make sure we have adequate diet. One of the big things that we're worried about for this is calcium influx. As people get older, their bones become weaker. By making sure we have calcium taken into the body and some sort of load-bearing or strength-bearing exercise, we can make sure their bones are stronger, which reduces the chances of having an injury if they do fall. Okay. Figure 19-6 talks about likelihood of death from non-communicable diseases. As we can see, injuries is the #1 cause of death in people in their early ages, and that kind of transpires through to 69. We still see a lot of injuries causing death there. But as we get older, we tend to see that mental health and other non-communicable diseases seem to be a cause of death. Cancer rates are slightly higher as we get older, which is a sad thing, but cardiovascular diseases tends to increase as well. So what we need to do is make sure that people, as they get into their middle ages, start participating in some sort of cardio program, so that they can get their circulation adequate and sufficient enough so they won't have a heart attack as they get older. The heart actually has 7 blood vessels around it, the coronary vessels. coronary arteries rather, and they become blocked because of lack of exercise. Your heart rate doesn't get high enough, lack of adequate nutrition, eating poor, unhealthy foods, fatty foods, sugary foods. So what we're trying to do is make sure that people exercise to get the heart rate up to at least 80% of resting rate for at least 1 minute of every 10 minutes of exercise, about 20 to 30 minutes a week, to clear the cholesterol and fat from around their heart so they can survive at a longer age. Figure 19-6 is the adults' ages, likelihood of death from non-communicable diseases. Actually, we just did that one, sorry, it went backwards. Next slide. Okay. Annual number of deaths of older adults greater than the number of deaths of younger adults. As we're seeing, mortality rates now are increasing because a lot more people are living to older ages, and we're seeing that the mortality rates of older people are much higher than younger people, which is a good thing, which means you can live to an older age and die at an older age as opposed to dying at a younger age. Though the numbers of death seem to be more associated with non-communicable diseases, mental health, cancer, cardiovascular and other causes. Okay. The next chart is 19-8. There's considerable variation by country and distribution of cause of death among adults of typical reproductive ages. And what we're seeing is people from ages 15 through 50 years of age, pretty much throughout the world, are subject to non-communicable diseases, more so in the United States, Germany, Iran, Brazil and China, India to a degree, whereas in Nigeria and Ethiopia we see a higher increase of infectious diseases or maternal disorders that causes increased mortality. Okay? What this means is that we need to start looking more at the developed countries with regards to non-communicable diseases and mental health, and try and reduce those numbers, and also in the third world countries try and reduce the amount of infectious diseases by making sure they have access to medications. Okay. The next area or category is preventing disability, and this starts off in younger ages. To prevent disability in older ages, you need to be healthier as a younger person. The healthier you are, the less disabled you're going to be as you get older. We tend to see that the years lived with disability are much lower in younger adulthood, even though there is a higher mental health disorder rate, depression. In middle adulthood, we're more likely to see disorders associated with hypertension, lower back pain, fatigue, lack of energy. And older adulthood, we tend to see more presbycusis, lack of hearing, lack of vision, more apparent than anything else. We also see again pain associated with that, lack of coordination. So those are things that we need to look at to prevent disability. If you can't hear properly, we advise getting hearing aids, and we're making those accessible and as cheap as possible. With the promotion of Bluetooth technology, now we can have hearing aids associated with cell phones with Bluetooth devices, which can help them become cheaper and readily accessible. Hearing aids used to be of the thousands of dollars. We can now pick up cheaper hearing aids for a couple of $100s. And as the technology gets cheaper and cheaper, those hearing aids will be cheaper and cheaper and be accessed throughout people throughout the world. The other thing we mentioned was presbyopia, which is poor sight, and we're trying to improve that by making sure that we have glass programs or spectacle programs in third world countries where people that are older and can't see have access to glasses. So instead of throwing your old spectacles away, one of the things that you could do is donate them to a charity shop for older people in the United States, or donate them to charity organisations who will distribute them to third world countries so people that can't afford glasses can have access to them and be able to see. Now, the other thing that we have to worry about is preparing for a healthy aging. Now the way to do this is to make sure we educate younger people to be healthier so that when they get older they're healthier. And the ways to do that are avoiding unsafe sexual practices to prevent HIV, prevent sexual disorders, communicable disorders, promote safe use of alcohol, advise people about the harms of alcohol and now illicit substances, and avoid all tobacco products. We talk about tobacco as one of the things that causes lung cancer more so than anything else. But in reality, you should be more worried about the effects of tobacco on your lungs, for respiratory disorders, for your heart, circulatory system, mental disorders as well, because it can cause brain tissue disorder damage also. So again, stop smoking is not good for you. Using medications is also promoted. If you have hypertension, we need to make sure you're taking blood pressure medications to bring that blood pressure down, and we're trying to promote that in third world countries as well. Also to lower cholesterol. Now, a lot of people think that you get high cholesterol from eating fatty foods. then you do get cholesterol from fatty foods, but one of the bigger risk factors isn't just the fat, it's the amount of sugar we have in the body. Because the liver actually processes those sugars into cholesterol, and it gets into circulation, and that makes you ill as well. So in order to get lower cholesterol, lower the fat intake, and lower your sugar intake to be healthier. So we're trying to encourage people to follow a healthy diet throughout the world. We also need to make sure we maintain a healthy weight throughout your life, making sure you eat properly, just the number of calories you need to be healthy, by determining what your ideal weight range should be and trying to stay within that. Studies have found that if people go above 10 pounds higher than their ideal weight range, that's when they start developing type 2 diabetes, hypertension, circulatory problems, and the more weight that you increase, the worse it becomes. Okay? Health promotion for older adults now. This is where we need to make sure the older adults have support systems around them, people to help them become independent, people to help monitor their chronic conditions so they can stay healthy and remain healthy. Quality of life can improve for these individuals if you make sure that you're there for them or have access to people to take them out, get them moving, helping them believe in themselves and stop them becoming depressed. Depression is a killer. If you get depressed, it's going to start making you feel like you're worthless, and you stop taking care of yourself, and it just becomes a snowball effect. The snowball gets bigger and bigger and bigger, and there's nothing you can do about it. So again, have a positive outlook, and you will live to a healthy old age. Individuals need to avoid suffering. One of the ways to do that is with social support, spiritual support, or other support groups around them. This is very important for the last weeks or last months or last days of someone's life also. By having people around them to make sure that they feel good and comfortable helps them leave life with some sort of dignity and not fear. Okay? Caring for older populations. Many old people take care of grandchildren, provide training and guidance for younger employees, provide cultural heritage and sharing wisdom gained through decades of life expectancy. By having these people in your life, it gives them a reason to live and want to try and want to exist. But you still need to make sure these people are healthy and are cared for, even though they may be caring for you or your children. And what we need to do is be involved in them. Unfortunately, if we look at the world globally, we see a large percentage of older people not being looked after by their children, but being looked after by spouses. In third world countries, we see a high number of children, because they have extended families, looking more so after their family members, their parents. We're trying to promote more of that in the US, where even though we're states apart, we still have access through media to see how our family members are doing through Facebook, Zoom, telephone devices, FaceTime, and what have you. Okay, so we need to make sure that everyone's okay and healthy. Unfortunately, if we can't provide that type of care or assistance for these individuals, the institutionalization occurs. Unfortunately, most people, when they become institutionalized, usually die within 2 to 5 years of being placed in an old person's home, because lack of care isn't provided as sufficient as they could have at home, being cared for by somebody else. Okay. Right. In third world countries, we have decreasing fertility now also, which means there's less children being born, which means as the progression occurs, there's less people to look after their adults when they become adults. So we need to make sure that there's some sort of adequate state-provided assistance where older people can get that assistance and live a normal, healthy life, as opposed to end up being institutionalized and their mortality rates increase because of that. Now, the demographics behind this talks about the demographic ratio, which is the number of dependent children and older people for every person of working age. And what we're seeing is there's an increase in rise in high-income countries as a result of aging. There's more and more people getting older, which means there's more and more people having to care for these people as they get older. We see that increase in number in healthcare providers caring for older population because they don't have access to the population, to the care facilities at home, because there aren't people around there to help them. Part of that's also because you may be born in Illinois, grow up in Illinois, and become old in Illinois, and your children unfortunately may be on the East Coast or the West Coast or somewhere that's not Illinois and can't provide for you. So those are things we have to look at. The statistic that they talk about is the elderly support ratio, which is the number of people aged 15 through 64 for every 100 people, 65 and so on older. Unfortunately, that number, as we seem to be progressing through time, becomes lower and lower because these people don't have the access to those individuals to take care of them. And then lastly, the aging index, which is the number of people age 65 or older for every 100 children under the age of 15. And the aging index indicates now that we have a lot more of an older population, or a trend going to that way, than we have for the younger population. Living older is great, but making sure you have access to care is also important. And that's why we're seeing an increase in numbers of healthcare professionals, healthcare workers, providing assistance for an older demographic group. Okay? Now, one of the things that we have to do is make sure we plan for our aging populations. Few countries are actually prepared to provide that type of care. Mostly it's developed countries, first world like the United States, and most countries in Europe, they're providing care for a rapidly increasing population. And even that may not be sufficient enough, because the lack of dollars or the lack of funding towards institutions to help these individuals age and progress normally isn't there, or isn't as apparent as it should be. Unfortunately, as we're living older, Social Security becomes less and less, and we don't have access to funds to provide these people the type of care that they require as they get older. And health promotion across the lifespan. We need to make sure that we improve socioeconomic functions throughout the world. Environmental conditions for entire communities have to improve as well. Global warming is a thing, in the fact that as the temperatures rise, it becomes harder to grow crops. As populations increase, we don't have access to land or access to the resources that we need to provide for our population. And that's where we need to start putting or focusing our energies. Alternative energy is great, but we still need to make sure we have food and space and have fresh water for these individuals, so they can age and eat properly, have better nutrition, and be a healthier older person. Okay? So one of the biggest things we're trying to do is end poverty, reduce gender inequalities, which is a very hard thing to do. Gender inequality does exist basically because men have a higher productivity than females do, because women have to have babies and have taken time off from work because of that, and that creates an inequality there. So time spent in the workforce for the majority of women is less than for the majority of men. And getting back into that workforce afterwards is much higher than it would be, than it should be. So once you've had your children, you started raising your children, you can go back to work. It becomes tougher to get back into that, because you're now competing with people who are in the workforce originally and still in the workforce, and with a newer population coming to that workforce, it makes it much harder to get back in. Thank you. Test will be next week. Hope everything's good, and I hope you guys stay healthy. Bye now.